goes nothing. Glad it appears that way. Hey everybody, thanks for being here. We are learning this hybrid system. So Zoom people, welcome. Everybody wave at the Zoom people. Hey Zoom people. So if you can't hear us or anything is not working on your end, please yell at me. Because again, we're trying to figure it out over here. So hopefully this will work for everybody. Can you all hear okay, Zoom people? Somebody.
Yes, ma'am.
Yay, awesome. Okay. So we will go ahead and get started. I've asked all of my Zoom folks to sign in the chat. If we can really quickly have everybody that's here in person, just share who they are and who they're with. And then we will get started with our meeting. So Emily, you want to go first?
Yeah, sure.
Okay.
My name is Emily Brooks, and I'm with the Landry-Faith City Schools. I'm the Director of Coordinated School Health, and I've just moved to that position. I live at the Carter County Health Department of Health Care Programs. So just started with schools at the city schools. My name is Chelsea Isaac. I'm with the Landry-Faith City Schools as well, and I just filled their new position that they just got as the school director.
I'm Sally Reeves, Project Coordinator with Harper County Drug Prevention.
Hi, everyone. I'm Emily Wells. I'm the Northeast Regional Coordinator for the Mental Health Association of East Tennessee.
I'm Eric Landry, Tennessee Department of Mental Health and Substance Abuse Services with Faith-Based Initiative. I'm your East Tennessee Community Coordinator.
I'm Sarah Orrick. I'm transitioning into Project Access's Community Liaison position, but as of this week or so.
I'm Megan Fields. I'm also with Project Access, and I'm transitioning from a patient service coordinator into the lead enrollment specialist. So yeah, we're just transitioning all over there.
And I am Caroline Rodriguez, and I'm the Tennessee Voices Provider Connection Program, and I am the new care coordinator.
I am Yolanda Gaston, retired. Ex-school nurse with Carter County.
I understand you much better if I can get familiar with the way.
And I'm with Groups Recover Together, and I'm the community outreach manager for the entire state of Tennessee.
Hi, everyone. I'm Jane Harper. I'm with the Tennessee Department of Health as the Health Council Coordinator. Bernie Beeson, the Director at the Library.
Speaking at the work. Jason Shaw, I'm the police chief here with the.
Awesome. Thanks everybody for being here. Dolly, will you just type everybody's name in the chat? The Zoom people can't couldn't hear everybody. So if you don't care, just and maybe Jane will, if you'll give her the sign-in sheet. The Zoom people just want to know who's in person because they couldn't hear everybody. Okay. So if you don't care, let Dolly's going to type all the names in the chat. So hopefully y'all have them in just a second. Okay, I'm Jillian Reese. I'm the Director of Carter County Drug Prevention. Thank you for being here. Thank you for bearing with us today as we try this hybrid meeting for the very first time. So super appreciate everybody. So you have on your agenda or in the chat box, if you're on Zoom, the meeting minutes from July. You also have the community report and community calendar updates that were submitted. So take a few minutes and kind of look at those. And if there's anything else that is not on there that you would like to add, please let us know or share them with the group. Anybody have anything? All right. Well, we will move into our sharing session. Today we have Ande Hall with us. Yay. And Ande is the community outreach manager for Groups. Groups is an outpatient opioid treatment provider that encompasses medication-assisted treatment, weekly group therapy, and care coordination all under one roof. So Ande, if you will Wherever you want to go, wherever you go though. Yep, I'm gonna bring the sound to you though, so Zoom folks can hear you.
Okay, so again, I'm Ande Hall. I'm with Groups Recover Together. We're fairly new in Tennessee. Our only office right now, brick and mortar, is in Knoxville. And in the next year and beyond, we're gonna open throughout all of Tennessee. But right now the next one will be in Morristown. There's gonna be one in Johnson City. There'll be one in Kingsport. Will be one in Sevierville and Greenville, and I imagine probably here. So there'll be lots of access to it. It is an outpatient opioid treatment opioid use disorder treatment provider. That's a mouthful. But like she said, like Jillian said, it's all under one roof. So our members get Suboxone, but they get 7 days at a time. So 100% of our members have to attend a group meeting every week. And when they attend their group meeting, they get their next 7 days of Suboxone. So, and the group meetings, they choose the time. And so they meet with the same 10 to 12 people. Right now it's all virtual, but they're going back to the offices at the end of September. And so they meet with the same 10 to 12 people. So they get to form a sense of community and recognition and, support with people that they know and they trust and they see every week. We also offer care navigation. So if people, if they need to file for unemployment or they need help finding a job or whatever it may be, getting their kids back, we offer that as well. So although they're required to attend this weekly group meeting, they also offer individual counseling and family counseling as well, if the members choose to have that. So the goal at groups is to have people within admitted, like there's 24/7 crisis counselors. So if somebody decides at 2:00 in the morning that they're ready for recovery, they can call our central intake and they can talk to somebody and they'll get scheduled for an intake, their first 90-minute psychosocial intake meeting with a licensed clinical social worker. And unfortunately in Tennessee, because it's been all virtual, we're scheduling about 3 weeks out. The goal at groups is 24 to 48 hours to get somebody into their first appointment. And then they'll get started on their Suboxone. And fortunately, I have a very good friend who has a boyfriend who is addicted to heroin. She didn't know that. She found out, and they had their first experience with groups in Knoxville virtually. And she said that they were so professional, friendly. I mean, so I'm on the outside of the office, but I unfortunately have experience inside the office as well, but it was a good experience. So just wanted to let you know that we have these that I have not posted because we're kind of backlogged, but if anybody wants these to take and people can tear them off and they just call the central intake. If you've got somebody with you and they need to call, you can call for them, but they just have to be there because there's a few questions that need to be answered that they need to answer. I brought some information on who we are at groups, so you can take that as well. And then also, if you go to joingroups.com, they came out with this, it's the Groups Addiction Recovery Playbook. And it's for what we were thinking about, like maybe in jails or, just for people, even in waiting rooms or in patient rooms or wherever it may be in sober living, but it talks all about the recovery process. And then in the back, there's little activities throughout, but there's also like these kind of coloring pages that just to help people's mind stay busy. So that's about it. And then I also have these little cards that have the central intake number if anybody wants some of these. And I've got my own business cards, but these just have the central intake number. Does anybody have any questions about? Yes. So that's a good question, but we are for profit, so we can't apply for grants, but we can accept grant money. Like if somebody's got grants and they can want to pay for members, we can do that. So anybody else have questions?
Do you have a sliding fee scale?
So, that's a good question. So we do take 10 care. So, and then we take pretty much every other commercial insurance. And if they're cash pay, it's $65 a week. And if they can't pay it, they'll work with them to figure it. There's not really necessarily a sliding scale, but very much harm reduction. So, if they're using polysubstances, they'll focus on the opioid use if that's the primary thing. If they need a higher level of care, we'll refer them out to higher level of care. If they need behavioral health, we'll refer them out for behavioral health. And what they found is if they're using like marijuana, what the counseling part of it, the group therapy part of it has helped reduce the other things that they're using as well, whether it's meth, whether it's, smoking pot, whether it's drinking, it just kind of helps reduce everything, even though the focus is really on their opioid use. So, yes.
What kind of down plans do you have for your clients?
So, I think the typical time frame that they try and focus on is 18 months. So they'll give them at least a year, 18 months. If somebody's ready to come up before 18 months, they'll work with them to take them up then. If they need to stand a little bit longer than that, they'll work with them to figure out when they're going to start coming off of Suboxone. But the goal is to come off of Suboxone. And then after they come off, they still have access to the groups and the individual therapy, the group therapy, and the care coordination after they're off of their Suboxone. So it really is kind of individualized, but the goal is to get them, the rest of their life kind of put back together and then come off. So, but I think they found that about 18 to 24 months is about the time frame when people have, been confident enough to start to wean off. Not for that member, no. If they need to come back in, they're welcome to come back. If they get to that point where they can come, they need to come back. But no, once they've weaned off, they're done. Any other questions?
How's the success rate?
Well, okay, so the success rate is, I don't know the exact data, I can get it for you. But I will tell you that they did a study out of Maine, and they took 300 people that had been incarcerated and followed them. And so they scheduled them all, they all had a scheduled first intake. And 74% of those 300 made it to their first meeting. And of that 74%, 92%, I believe it's 92%, were still out in the community a year later when they followed them. So I do have that data, but I can get the rest of the other data for you. Yeah, it's good. Good question. I guess I should know the answer to that. Anybody else? So I'm excited to share. Thank you for letting me share. And if you've got questions, I've got cards. Call me anytime, email me, whatever. I'm happy to answer anything. Thank you. Thank you. Glad to be here. Yes.
Thank you. So I've also asked Eric Landry to share with us just a little bit. We have not had a faith-based program coordinator for a while, and so we're really excited to have him here. And I just want him to share a little bit about what he does and sort of the ways that we can support him and he can support us in whatever we may be doing. So I'm going to turn it over to you.
You're gonna stand next to me.
I'm gonna lay it down, but I have to figure out one thing first.
Okay.
How to make this phone the host and not this phone the host. So there we go. Now you're good. Now all the Zoom people can
Now all
hear
the
you.
Zoom people can hear me too. Glad to be with y'all. Glad to be in person. Some of you know my boss, Money Burks. So a lot of folks say, you work with Money Burks. Actually, that's my boss. Faith-based coordinator for East Tennessee, all 33 counties in East Tennessee. It's a lot of area cover. Most of it's uphill, which is a little stressful in some counties. Anyway, what we do is we go out to congregations and the ministries, and we help those folks either start programs, we provide training for them, or we get them connected with ministries that have programs so that if they don't want to deal with folks that have substance abuse and mental health issues, we can get them to a program that does want to help those folks and does want to help that community. So what I'm really looking for is I'm looking for congregations and ministries that are safe spaces so we can send and we can refer. And so we can get folks connected with Project Lifeline if they need to go to treatment, if they want to go to 90-day treatment or faith-based treatment, or they just need IOP. We need to connect those folks with services and connect them with the appropriate services that fits their insurance, that fits their needs, that fits their socioeconomic as far as their faith, what their faith is. Some folks thrive in a faith-based community. Some folks just don't do well in that. So we need to fit those folks to a proper level of treatment. Also, with some of the syringe exchange services that we have in Knoxville, we also have recently started one Live Free Claiborne in Claiborne County to come in and talk about stigma, to do trainings, to talk about QPR, trauma-informed care, ACEs, strong brains, addicted brain. I'm your trainer for most of that stuff. I'll leave cards. and a few packets here on that. We also talk about the CPRS program, where for free folks can get state training for a week, and then they can start having supervised hours to actually get a certified peer license so that they can actually help folks in the community. And those are usually our champions, especially in rural communities, that we can go to have people provide folks with services. So I'm going to leave several packets here that's got a lot of this information in it. Also, I'm sure you're all familiar with Jason Abernathy. He's your local lifeliner. I'm going to leave the map for Project Lifeline. This gives you all the contact information for everybody in the state and what areas they cover. We also have regional overdose prevention specialists. And what these folks do is primarily break down stigma and do naloxone training. The naloxone grant base is under the SOAR grant. You can get Narcan for free. Folks will come in, they'll do the training for them, and these are your regional overdose prevention specialists that can provide you with Narcan. So,
Eric, what does CPRS stand for?
Certified Peer Recovery Support Specialist. So, yeah, it's a state certification. These are people that have lived experiences, whether it be in substance abuse issues or mental health issues. People helping people that suffer from the same issues that they've had in their life. I'm a national certified CPRS and a state certified CPRS, also a recovery coach, 19 years clean and sober, Air Force instructor prior to this. So kind of intimately acquainted with the way stuff works. I'll take another minute and a half. I look at this as, if you look up the word stigma, one of the definitions for stigma is a stain. And what I see over and over and over is there's a stain of addiction that people have that stigmatizes them in their communities and in their churches and in the way that people treat them. And they'll go to treatment and they'll start getting some help, and it'll start lightening that stain of addiction. And what we find underneath that stain of addiction is childhood trauma, sexual abuse, physical abuse, different things that they've gone through in the past. It's so much easier for folks to take that dark addiction stain and to cover the trauma instead of working through it. And we want to connect folks to services, not just for substance abuse issues, but to lighten that stain of stigma so we can get to the root, we can get to the trauma, we can get to the ACEs. So we can keep people alive long enough to get them services. So, any questions for me? No. I have cards, I have packets, please. I'll be here. I'll hang around after. Thank you, ma'am. Appreciate the time.
All right, we still have a few extra minutes. If anybody has anything they want to share, maybe coming up. I'm gonna pick on Brooke for a second. Will you share about Kids Who Know? So recently, Harper County Drug Prevention has started. We've started a Children of Addicted Parents support group, and we've collaborated with AA to have a meeting at the same time so that we can encourage family recovery. And we do like 6 topics on a rotating basis: addiction, treatment and recovery. A child up there. Coping skills, healthy communication. I'm trying to think. It's just, I was not prepared. And safe people. So it's just like several different topics that we just have different activities each week. And it's been, so far, it's been really great. We've had every week that we've done it. We started in January, and we've had at least 10 kids every week. And then their parents, they're not always the same kids because sometimes the parent won't come to the meeting, but we have opened it. It's open for kids who the parent doesn't have to stay for AA if they don't want to, but they are welcome to. That's all we have it there. So it's open, like if grandparents, even foster parents want to bring their children to come. It's really just an awesome program. We use the children's program kit from Santa, and yeah, that's pretty much it. But it's been a good experience. And AA, they've had good numbers for a brand new meeting, because this is a brand new meeting. So they've at least had like 10 people to hire every week. So, you have a
This is
question?
just something that's happening while AA is happening.
Yes, same time.
Is it open to everyone?
Yeah, it's open to anyone and everyone who wants to come. If you want to, even if they don't have addictive parents, they can still get something out of it because they, it's just learning healthy living skills pretty much. So, there is that focus though on having parents with addiction problems.
Did you say the age ranges?
It's elementary through high school.
Oh, okay.
So we've had a pretty wide range, and I'll just prepare, whenever I prepare the activities, I'll prepare like a high school, middle school one, and I'll also prepare elementary school. It's the same topic, but it's a little different. And so if I have to, then I will incorporate both activities for different kids. So anything else? Okay. And that's every Thursday at 5 o'clock. And also afterward, we have a family meal so that they can practice their healthy living skills in there. So, cool. What do they do? Every Thursday, 5 to 6. Oh, at the Will you put that in the chat, Dolly? Because I walked away from her. We will put. A referral form that I talked about. If you have any clients who you would like to refer to, I'll just reach out to them and just invite them. So Dolly's gonna put Brooke's info in the chat. So if y'all have questions about that or want to learn more, you can reach out to her. Sorry, Jane.
What were you saying? I was just gonna ask how to reach out to you.
Perfect. Okay. Awesome. Okay, and so our last folks today, I've got some folks from Recovery Soldiers that are going to share just a few minutes about who they are and what they do. So I know this is weird, but we have people on Zoom listening to you and people in this room listening to you. So I'm going to stand here with this phone so everybody can hear you.
My name's Bobby Morgan. I'm a student in Recovery Soldiers Ministries. We're a 12-month faith-based discipleship program. We house men and women who suffer from drug addiction, alcoholism, and teach them Word of God. We have 5 one-hour Bible studies a day by 5 different preachers. We go back out in the communities and help rebuild the things we destroyed while we were in our addiction. We also go out to different churches and testify about the things Jesus Christ has done for us. We just recently opened a women's center up. I've been in this program 9 months, and me and my wife are involved in drug addiction together. And God bless my marriage enough to allow my wife to be the first one through the women's center doors over there. So we're just trying to, show people there's always a better way instead of, living a life of drugs and stuff.
Will you talk just a little bit about the Women's Center that just opened?
The Women's Center just came open April the 19th. It's got, I think, 12 women in there right now, and it's pretty much based off the same thing. It's faith-based. They do pretty much the same thing we do. They have a call center. They call and pray with people over the phone. They actually go to church services also on Sundays. They're trying to reach out to more places, like jails and stuff like that. They're trying to get Women's Center also filled up.
Any questions for them?
What was the name of it?
Recovery Soldiers Ministries.
Okay. Thank you.
It's just right in here off Bristol Highway.
Okay.
And then will you share about the thrift store?
We also have a thrift store. We take donated furniture, clothes, tools, just whatever anybody wants to donate. We got a box truck that will come and pick it up.
Did y'all hear that? They will come pick up your junk.
Yeah.
Amazing.
Yeah.
How far away?
Bristol Highway.
We're on the Bristol Highway. Usually go Johnson City, Kingsport, Bristol, stuff like that.
I'm actually the box truck driver. I went to Kingsport. I've been to Gray. I've been to a lot of places really.
So what all do you take at the store?
We take furniture, clothes of all ages, and electronics, anything you really want to donate.
We also have an auto center that we take donated vehicles, we try to fix them up and sell them back to the community.
And then sometimes like the
You can
vehicle,
come pick those up as well.
the vehicles that they do fix up, like if the student graduates from the program and he's got his license and he needs help with the vehicle, they usually give it to the student.
Y'all are doing amazing work.
Thank you.
Can you give us a telephone number for Either one or truck pickup.
I can give you Dylan McQuillan's number. He's actually the intake coordinator. And then Greg Haynes is actually over the thrift store. The thrift store number is 423-470-1620. And then if you know anybody that's struggling with addiction or anything, Dylan's number is 423-609-6117.
Also, Mitchell Presnell is over the auto center.
Yeah.
And his number is 423-440-3505.
Y'all have got graduation coming up soon, right?
We just had a graduation, actually.
Yeah.
29.
It's gonna be one every month until.
Yeah. That's awesome.
That's what I
Awesome.
looked like when I came in.
Oh, wow.
I was a 26-year drug addict. 15 years ago, zombie drug use and methamphetamine.
Congratulations, guys.
So fun.
I got the phone numbers, I think the names for the last time.
Mitchell Preston is the 440 number. And, yes, ma'am. And then Dylan McQuillan is the intake, and that would be the, what's Dylan's number?
Dylan's number?
That's the 609.
Yeah.
His last name is McClellan, McClellan. McClellan.
And then I can also give you EJ's number if you know anybody that has jobs that need to be done, because we go back out to communities and work. A lot of times he'll do it on donations, but a lot of times he'll, come out and estimate it, because that's how we don't get no help from the state or federal government, so that's how we keep the ministry funded.
Any more questions for them?
EJ's number is 423-972-7777.
Dolly's putting all these in the chat for you, Zoom people.
After your participants graduate the program, what happens to them?
We got a transitional thing we do. They have trailers they can transition out to. They can have a 6 months internship. And if they decide to stay on with the ministry, they can sign on to the ministry. If they decide they want to just go find a job, PJ has relationships out in the communities with, like Willie's and other places that they can go get a job at work and still transition out to a trailer. Because they don't feel like, it's a year, especially for me, 26 years being a drug addict, a year is not going to do it. So I'm going to sign on to the ministry. And so is my wife when she comes out, because we need a constant accountability around us until we can get more stronger in our faith with God.
So, get paid for signing on to the ministry?
Yes, ma'am. They give you, they let you stay in their trailers, and I think, I can't even remember exactly how much it is, but you get paid a percentage on the fundraising tables. And then I think it pays you so much a month or something like that.
Any more questions for them?
They also do church services.
Mm-hmm.
Yeah, we go to different churches. I've been here 9 months, and this Sunday will be my 50th church I've been to. I lead sing for the fire group here. I testify a lot. Just more of the Holy Spirit works on you, the more you want to be both Jesus.
Any more questions?
We also do a service on Thursday nights, just tonight at 7. Y'all have a chance, come out, so on Old Bristol Highway, 1180.
And we have popcorn and coffee from 6 to 7, fellowship, just get to see everything. Because all the guys that was in there before us and some of us now has actually built that sanctuary and actually, done all the construction work around there, and also all the construction work at the Women's Center. And also to add on to the transitional out, if you ain't signing on like me, I'm going back home at the end of this month. I graduate. And PJ's got relationships with the church back home where I'm at. He also has different ones. So like I'm already connected in with that church, and I'll be going at home church, so that I will always be tied in with these guys when they come down that area and testify and do services and stuff like that.
Yeah, they always try to make sure you got some type of accountability for when you leave.
Anything else?
What's that church service one more time? Y'all do African soldiers.
It's called Redemption House. It's at 7 o'clock tonight. Pastor Josh will bring the message. We have a live worship band. It's something else. There's usually like 250, 300 people there.
Anything else? Thanks, guys. Appreciate you.
Thank you.
Okay, any more updates from anybody before we go into our breakout sessions?
I'll throw in real quick. This is Marissa Aramburu with Village Behavioral Health, and we are finally in contract with the United Healthcare Community Plan. So now there's almost no insurance that we can't take. We're very excited about that.
Marissa, for anybody that doesn't know, will you just share really quickly what Village does?
Yeah, so we're a residential treatment facility for adolescents 13 to 17, male and female, for mental health and substance use disorder. We sit on a 65-acre campus over in Knoxville.
Thank you.
Thank you.
Anybody else have anything? Bernie, will you share where the library is? I know we have lots of questions about opening and closing and what's going on and all that. Okay. Oh yeah, sorry, I'll bring it to you.
So for everyone who does not know, the library is back open, regular business hours and things like that. We recently have opened up our meeting room spaces, so those are available as well. So if you have any questions about that, just let me know. So.
All right, anybody else have anything?
I'm sorry, I had to step away for a second, so I don't know if Caroline talked about our program. I'm sure she did. And I'm sure she did an amazing job. This is Lupe with Tennessee Voices. I just wanted to mention, because she probably didn't think to mention it, we are hiring someone within the Survivor Connection program, not to cover the Northeast region necessarily, but to cover the East. So if you guys happen to know anyone that is in the Granger, Morristown area, Knoxville, we are hiring someone for a family support specialist position.
Awesome. So will you share just a little bit more about Tennessee Voices and what y'all do?
Yes, of course. So Tennessee Voices has really expanded in the Northeast, very much to my liking. I grew up in Northeast, so this is home to me. So anyway, now that spills over, so we have the Survivor Connection program, which is our program that Caroline, that's there with you guys present, and myself are a part of. And what we do is work with families who've been victims of a crime. And so what we do is that we come into the home, we meet with them once a week. The main focus of our program is to provide education. So we might put them through a domestic violence curriculum. We might just talk to them about trauma and how that trauma affects the children and what that's going to do long term, right? We also set them up with resources. We connect them with referrals. That's how come we become partners with a lot of the agencies in the community. And so that's kind of what we do. And we do a variety of other things. The main function that makes us a little bit different is that pretty much everyone that works for Tennessee Voices, I think the official number is over 51%, but I'm telling you, I don't think I've met anyone that hasn't experienced some sort of trauma in their life that's employed with us. So we don't come to people from a perspective of we don't know. We've been there, we've drank the Kool-Aid, it's painful, and we get it. So that's kind of what we do. And there is other programs. There's also the State Family Support Network, which Stacy Justice may be on the call or maybe in person, and also Connie Wells. They cover the Northeast region. We also are happy to send out referrals for SOCAT, even though there is, I believe, Frontier Health covers SOCAT in our region, but there's definitely always expansion. And across the state, we do therapy. We do have telehealth services. We have medication management. We have anything that involves us with being able to provide mental health services to underserved populations and rural areas. So that's kind of what we do, sort of. There's a lot more I'm sure that I'm missing out on.
And hey, anyway. This is Stacy. I am on.
Awesome. So there you go. Stacy can tell you guys so much more about her program. I'm telling you.
So we have actually two grants. Connie Wells is project director of one, and I am project director of the other, but they're family networking grants. And the one that I am project director of is the Tennessee Voices Rural Family Network. It's a statewide grant, and what it is going to be doing is setting up partnerships and accessing resources for families in those rural counties. Connie's grant right now focuses solely on this area. It will be up in 2 months, and then we'll focus on the whole state. What they did with the initial grant was kind of set up a model over here for the next awarded grant, which is the one that I'm project director of, to go ahead and then model across the state. So we're in the process of doing that. So yeah, that's about it.
Thank you.
Uh-huh.
Right. Anybody else have anything before we move into our breakout rooms? Okay. So this is going to be the fun part of this hybrid meeting, figuring out these breakout rooms. So if I can have Dolly's group with your phone go to the first room we were in. So Dolly's group is the substance use committee, substance use and mental health. Give like a 3-second what you do in that group.
Oh, okay. So with substance use group, what we're doing is we focus on ways to raise awareness about substance use and raise awareness about stigma. So we do any kind of projects around that. So if there are like resources that you want to get out to the community or know about, we take on that. We also do like if there's like a national tobacco prevention week, we can look over that. We try to figure out how to promote it via social media or via our networking. So it's really anything that encompasses substance use. We also work on the Harper County Collaborative magazine, which is another way to get resources out to the community.
Thank you. Beautiful. Love it. Okay. So if you want to go with Dolly, go to the room that you started in here today. And I'm also going to open the breakout rooms for Zoom folks. So you should still be able to listen in no matter what session you go to. Just join and somebody in that group will have a phone or have a laptop so you can join in. Committee B, anybody that doesn't want to stay for committees is also welcome to go. So no pressure to be part of this. Committee B is the Community Action Committee with Brooke Jones. Share like 3 seconds about what you do in that committee. Nobody knows.
Sorry, I was not paying attention.
What do you do in your committee?
Okay.
Community action. So this is the committee that does things like the food drives or clothes drives at Christmas or supporting people that have needs in our community in some way. So the action, getting people together for action in our community is Committee B. If I can have Tony's people for the data committee stay in here. And I will, Dr. DeLucia, I'm gonna actually make you the host so you can share and talk to your folks. And then the last committee is community partner support. So if you want to be part of that committee, that's with me. And we're doing things like resource guides and a video library for folks that are part of the collaborative. Okay. He is. So I'm going to make him the host. So he should be able to share and talk to you all.
Hey, everybody.
There you are. Awesome.
You don't see my screen?
Okay, they can.
Can you see my screen where it's set? Can you hear me?
Yep. Hold on just a second. Everybody's still getting rounded up.
Yeah, it's noisy.
Everybody's still getting rounded up.
I'll break this down. And going up here, do you see a easel? I don't know where we are, folks. It's so noisy.
I think I've seen you here. I know. Yeah. Thank you. It was like so crazy when I tried to email everyone, but I'm like, I forgot all the people that were. Like I've forgotten, but like I'm gonna miss someone.
I see Jane.
It's been so long.
Usually.
And she was my intern. Yeah, she's really sweet and she like.
Okay, so I'm gonna talk real loud if that's okay. I don't know if I should just talk real loud or what.
Hey, Dr. DeLucia, I think you're gonna have to join the breakout.
This is really less than desirable, but what the heck? Y'all hear me? Give me a thumbs up if you can hear me.
I can hear is not in breakout.
Let's see. No, not yet. Okay, hold on. So Tony, let's see here.
I'm sorry to be a pain.
Hold on a second. Dr. DeLucia, can you make me the host again? Do you know how to do that?
Let's see here. Share screen. There's two of you. You're the host now. It says you're the host now. I think that's an improvement that it says you're the host now, but there are two of you.
Okay.
I have two of you. I have a still of you and I have a live of you. Which is a little confusing, but that's all right. And who is 423-725-3167?
Morrison, can you hear me?
I just
Norma
heard
Morrison.
Laura Morrison. Hey, Laura.
Norma.
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 Norma, how are you?
Yes.
Welcome.
I'm good, thank you. Thank you all for doing this. I know it's a challenge.
Yeah, it's a definite challenge, but we've had a pretty active agenda thrown at us, and you can ask members of the group that if they agree, but we seem to, as a result of our last idea to get away from everything else, you might call them not distractions, but what embellishments that keep jumping up if we don't address a big agenda that the data group has had. We weren't getting anywhere. So we actually last week had a 1 hour call to see if we couldn't get more out on the table as far as where a number of us that have been with this group for a while sort of see some positive traction on data coming out of what the Health Council and also just the idea of contributions to some of the big issues with opioids and mental health seem to be happening. So I see Robin, Norma, thank you, Steve, Jill, Jillian, Jane is there. Is that you, Jane? And is that Emily? Emily? All right. Well,
Yes, hey.
pretty darn good. And looks like we need to kind of make a statement today. What have we been doing since our last meeting? Well, yours truly has tried to be faithful to maybe what Caroline said, maybe what Jane put into those minutes, which I'm happy to share with anybody, which is kind of Tony, don't get the twisties up there on the Olympic stage. Don't get all confused. Tell us what you want us to do. Tell us what you think our data assessment group can do. And it's been pretty clear that you all have given me a free rein to come up with a grant idea, which is to look at what the Appalachian Regional Consortium has offered in the way of small and large grants on the substance of substance abuse, and building an ecosystem, which is sort of a wraparound thing, which some of the members of this committee have talked about today, all the moving pieces and parts, which would help people who have been getting treatment for their substance abuse, aligned with employers, which is one of the big factors to get people on their feet and back in mind, and sustainably then helping in a number of different ways in our region. So this was the first time that I found a way that I could help with what the Appalachian Regional Consortium was all about. So I sent around the grant application. I couldn't really find, because I work off of like 2 computers at work and 1 at home. I couldn't find the PDF that I sent in at 4:59 p.m. on the day it was due to ARC. I'm still looking for it. It's somewhere. But I found the text of what Luke Dawson, who was the medical student that worked with me this summer, I sent that around. And then I've been working on a PowerPoint to kind of walk people through what this proposal to get some money in our hands to address how we would approach the system. And I've sent it to a few folks because it's a work in progress. It's like 50 slides right now, and it'll never fly as 50 slides, but hopefully you'll get a chance to maybe see a few things. And I didn't know if you wanted to see a few of those that are on my mind and then say, Tony, wait, here, it's obvious you're missing the boat. Or Tony, that sounds good. Or, you know, we're the data assessment group, but data assessment, you remember, Tony, when you took over this, was Tennessee Together survey, which was in 8th graders or something like that, and a logic model of what is kind of the putting the people together doing the, the who, where, what, when, why, and then what are the short-term, medium-term, and long-term objectives on our way to achieving what the Carter County Drug Prevention Coalition is all about. Very elegant, but very, right spot on the way you do things. So this practical approach versus taking a little bit of a deeper dive into what we now have pending, and there may be some money coming in because of just the momentum on mental health now, the momentum on substance abuse that our group might be able to take advantage of. This idea of deaths of despair, which is suicides, overdoses, and not so pertinent for our region, but alcohol-related deaths, has exploded in our country and is really exploded in Appalachia. And ETSU Public Health is looking at them. Certainly anybody like myself is looking at them. So what's your four things? Got to share my screen, or I can send this around and we can just have a general conversation. But the grant has gotten in several people's hands. I sent the PowerPoint to Steve because he wasn't on the call, and I don't know, because I didn't know you were in attendance. There were more people than I saw, but I can get it to you. Norma, I didn't send it to you. And is that Ande there? Screen? I don't know. And I and I didn't know you were there, Emily, but you can all get this stuff. How do we want to spend our time? We're going to be knocked out very quickly. I've been disabled from participant screen sharing right now, Jillian. So I can't, apparently with this model, I can't share it to you.
I'm trying to figure out how to fix that. Go ahead, more. Or share screen. Participants, yeah, and then do you see him? We're not here. We're all still in the main room. Still in the main room. Okay. So we're not in. Can you X out? What happens if you X out? Yeah, there we are. And then.
Okay. Do you guys see explaining Vetsasa?
Maybe more or settings. I know. Sorry, we're trying to figure out how to get you to share your screen.
Oh, I thought you were already seeing it.
No, we can't see it yet. Sorry, we're trying. What happens if you
That's okay. One thing I've learned with the twisties is don't get upset. Everybody know what those are? That's what came out of the great Olympic gymnastics. Simone Biles. It's not worth taking a fall and breaking your neck. Because each and every one of you will get this, and it's not finished.
Oh, I'm not the host. Her phone is the host. All right. Tony, I don't think we're going to be able to share this. Julian's in her breakout room, and she's the host. To share the screen.
No problem.
We're in the main thing.
I think you'll find that it's not totally overkill, but I'm really trying to go into everything from, what are deaths of despair? What is the Appalachian region? What are some of the abbreviations? Why did I go into such great detail on making it better than the quote county health rankings? Because I'm passionate about this kind of stuff, but I did. And you'll hopefully get a better understanding of.
I think you can share your screen now if you want to. You should be able to share your screen now. We gave you host power.
Okay, let's see here.
right, there you go. It's working.
What does that look like? Can you see that?
Yeah, we can see that. That looks good.
Okay, this is just like, hair professor. What are we going to do? We're going to explain this Veterans Substance Abuse Support Alliance. Okay, big wow. And then, like I say, important abbreviations, and then, deaths of despair. And then, because it's the Appalachian Regional Commission, a little bit about it, but importantly, what Appalachia really gets knocked for. But Appalachia is not one Appalachia. It goes from the north to the north central to the south central to the south central to the south. And so we want to look at it in our area, and this is not complete, and we want to look at it in 8 counties, and we want to look at it with 25 really little fine areas within these counties. For example, there are 8 census tracts which are in Carter County and like 5 census tracts within Sullivan County. Okay, so then I've got some blankies because I want us to collaborate. I was on a really neat webinar the other day with Ballad. So in the grant, here's a timeline because I forgot to mention this, but there's a lot of competition in this region with like the First Tennessee Development District already having a $1.3 million grant to do this ecosystem, but they're not looking at veterans. And I want to look at veterans. So I submitted this proposal, and this is an 18-month time period. And so if they fund the proposal in November, we would get our butts in gear and have a conference in about September, pardon my language, and then maybe have a second conference like a few months before the end of the funding. And a lot of this work have to be done just by the technology we're using of, Zoom meetings and things like that, because they're not giving us very much money, like $50,000 for this whole period. Doesn't hire very many people. Then write a report and maybe go for what's called implementation funding, which is $450,000 for 3 years. So why are these important? And maybe this is out of order, but they are happening to white, non-Hispanic males and females fitting the Appalachian type, you might say, high school education or less, and they've been linked to declining family resources. So the families are suffering, and a lot of it has to do with the declining jobs. So I wanted to see if you all were keen on this ecosystem being partnered of some of the people that we have on this call. And I'm going to go fast, but as a result of hiring a couple of 10-hour per week assistants, getting together like 12 small groups or 6 bigger groups and having those workers work like little worker bees, getting the groups to talk to each other and create a trajectory where we build towards that conference. And so it would be round after round of sharing using software called Mixed Methods Research Software. So the technical, GIS, blah, blah, blah. Now, as we're the data group and we want to go to the census tract level, look at all these variables that we're doing. We're looking at health. Oops, this one doesn't show very well. Behaviors, socioeconomics, access to healthcare, environment. So then I have a slide which says, okay, what are you talking about, Tony? So here's the county health rankings, the gold standard. Going to rush through those. Going to go on to what's called the social vulnerability index, which is these kinds of factors. 70,000 census tracts. That's where I was getting my census tracts. The United States Census. That's what I did last year when we were in lockdown. I learned some of these things. And that's a few health things and a few socioeconomic things. And then the last thing is from one of the hospital systems in New York. And it's just 700 cities, but we're right in there. So then I started saying, you know, this ecosystem involves employment. So what does the census tell us? It tells us things like types of jobs. And it tells you if you're a resilient community, what kind of jobs do you have? So I'm going to go real quickly through these. Any questions? Because we're running out of time, but I'm up to slide. And I'm just going through and showing socioeconomics now that we will be able to educate our work groups on, and then at the conference have some really good keynote speakers, have some great breakouts that the 6 to 12 work groups have decided are our themes. And then for round 2, which may just be a technology conference, say, we want to apply. We're bad enough, you know, in the good sense, to apply for this 450,000 grant. It may be with ARPA funding. If you know what ARPA is, that's the recovery program. And so that puts us up here, ever onward and upward. Do we have bright spots? And I think we do. Rural and metro. And I am just looking like crazy at what our vets look like. So I'm going to stop
Hey,
now.
Tony.
Yeah.
Hey, we're just like looking at this here all together. I guess we kind of feel a little overwhelmed because this is a pretty broad, or this is kind of a lot. And I feel like we need to narrow it down for just this committee for these purposes.
For what purposes? I couldn't hear you. Certainly I'm not saying you tell me to narrow it down, but in what way and for what reason? The grant's already in.
Okay.
I'm trying to explain.
I guess we didn't realize that.
Yeah, the grant is already in. I'm trying to explain that if this group wants to align with if we get money, and I've got some money for a couple of 10-hour per week employees, are the members of this group at all on board to attend the conference, participate in the conference, participate as part of the work groups, you know, that kind of a thing? Because at the end of 18 months, is Carter County Drug Prevention Coalition and Sullivan County, SCAD, going to be the kind of groups that go forward and say, hey, thumbs up, we need to think about an implementation grant? Because what I said was there's a $1.3 million Department of Labor grant. That could be all we need to do is fold in with them. See what I'm doing, Emily? I'm putting my hands together like this. We may not need to even exist, but you know what the good college, the old college try is? The old college try is saying we gave our #1 effort. And that's what I think ARC wants to see from communities, is the #1 effort. It's data driven. It involves collaboration. It involves possibly doing a best practice, or they wouldn't even give us the money. And you know, that's what I would hang our hat on, is that we're a data-driven group trying to come up with something really be proud of, solid. You know, no, I mean, I think you have to crawl before you walk walk before you run, run before you fly. But that's what we would be doing. You know, over in public health, they're doing this kind of stuff.
Go back to the circles, please. Go back to the circles, please. Because we finally understand what you're talking about. We want to see the circles so we can decide on which of the circles, you know.
The circles are these. The circles are these.
The 6
There's
circles.
12, there's 12
The
things
12
here.
circles.
There's 12 things
First
here.
cat.
And you could go like,
Okay, there we go. Right there. Okay,
Yolanda,
now,
you could
are those
go
circles
from
named yet?
you could go from the first one here to here. You could go from the second one here to here. You could go from the third one here. Or you could say a more logical grouping might be, we only want to do 6 groups, and faith and food, because a lot of places do food pantries, and so you might want to combine group A, well, whichever one was churches, the faith community. Maybe it's D. Maybe D combine.
Okay,
so you end up with
okay,
6.
Go back down. Okay, go back down to the list.
This one?
Yeah, so
Yeah.
we're just trying to look at what all the groups are so we can look at that a little bit longer.
That way we can make a better judgment of where we want to pigeonhole.
Yeah, and see, this was just throwing ideas out. This was just ideas to stimulate discussion. If you don't have a
Leave us there for a while, because there are some things in that little group that, yes, we can relate to better. So leave us there for a minute, please.
Absolutely. We never usually have this much time as a breakout group.
Yeah.
Okay. Now, all of that, which ones would be work? Which ones would we, you've got a veteran, I'm a veteran. I'm sure there's a lot of other veterans in here. But we can work with veterans group, health and care insurances, and possibly education.
Yeah.
But food also comes in with healthcare.
Yeah.
So we've got veterans, healthcare, and education. I mean, food.
Yolanda, we would be remiss not to look at everything.
Sir.
We would be remiss not to realize that this is an ecosystem, and we have to dot the I's and cross the T's eventually, or we haven't done justice to the ecosystem. That's why I was doing a brain dump when I did this. So you end up with something like this. I'll like this, doesn't have to be this, just like this, trying to be systematic the way I do it. It doesn't have to be like this. The group decides what are the topics, not Tony DeLucia, but it's got to be an ecosystem. What creates the ecosystem which helps people go from substance abuse to whole?
Yep.
Yeah,
but
I'm trying.
But we as a group, okay, dog.
Woo! Fun, huh?
Okay. I understand, but we as a group, can probably put 3 things together.
Why did we get
those saved?
Yeah, and how we all individually. It takes us a while. Yeah, Tony, you're just
You're breaking up a little
going
bit.
so fast. You guys
Don't forget, I didn't just write this for the data assessment group. I wrote this for the broader community. I mentioned the data assessment group, and I'm willing to pour my heart out in front of you guys. Please, 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 please. But you know, it's not like, you know, I'm saying, one, I need your approval, or two, you know, I'm going to limit, I can limit it. I can't limit it. I can't limit it now because it doesn't make sense to me to limit it the way I've built this, you know, built it from the ground up to take in the considerations of all these factors, all these moving parts. And if you know, it's a thing called bandwidth. If you don't have the bandwidth in this room to do what we're talking about, I've got to go find the bandwidth. And that's why I have met with a guy at ETSU, a guy at Muncie Church, a guy with the Tri-City Military Affairs Council. I'm going to meet with a woman with a group called Unite Us with Ballad. See, so I'm spending a lot of my time meeting with people who are, they can tell me no, but they can't stop me from trying. You know, I just, you know, I just try and try and try and try, because I'm not saying we're going to get this, but it's kind of like, I'm a marathon runner. I'm not a sprinter. I just keep doing it. I'm like the ever ready bunny. So I can get this to everybody and you can tear it apart and we can put it back together with a lot of changes. That's the beauty of it. And see, all I wanted to do was have something for an appendix to the grant. And we ended up not even putting it in as an appendix to the grant because it would have been confusing to them. You're getting something that is confusing. That's why some of these other parts of it are less confusing. You know, that's not confusing. It's the devil is in the details, right, Yolanda? The devil is in the details, but this is how I would operationalize working with my 2 10-hour per week people that are going to make peanuts. But I'm going to say, get in your car and go meet with these people. Get on a Zoom call and meet with these people in Group L and interview them. You know, send them a survey, and then we'll put it through this software called Atlas, which is survey software. And what are the themes? What are the words they use? What comes up in discussion? And you take that and you take it from all 12 groups and you say, oh my God, look at all those themes. But they break down logically into certain smaller areas. And that's what makes your conference. So you're looking at it like there's 12 different themes. Nah.
Can you hear me? I think we're cutting out pretty bad. If you can hear me, I think we're gonna finish up. And we're gonna send out this PowerPoint so we can all kind of go over it.
So let's just
But
say,
we haven't been able to hear you, Tony.
stick me with a fork. I'm done.
Oh. Can you hear me? It's pretty bad connection.
Yeah, probably me.
We're cutting in and out. It was going pretty good until just now. It's pretty much stopped. Yeah. Yeah, here I'm not just. Okay, you can.
No, I'm just wondering. Like too many people are on the Wi-Fi.
Oh, yeah.
I can have this one.
We didn't have any continuity.
No, I did not work. You can just put everybody back. I don't know what these are. You have to speak up your phone.
No, really?
What?
Okay, friends, if we can come back together for just a second. All right, so Committee A, if you'll share really quickly kind of what you guys discussed.
All right, so lots of great stuff. So we just we welcomed several new members into the groups, which is super exciting. So we kind of gave a recap of what our committee is. We also talked about some pretty awesome stuff coming up, which would be we're planning this huge like regional mental health awareness event thing, possibly for May when it's Mental Health Awareness Month. We also talked about National Suicide Prevention Week, which is going to be the first full week in September, and trying to plan about things around that, and also recognizing August 15th through September 15th as Latin Culture Awareness Month. So we're planning things around that as well.
All right, Committee B, will y'all share what you're working on? In case you have, yeah.
Oh,
will you share what you're working on?
Yes, we are doing the storybook trail and promoting physical activity through that with the book Eric Carle, Head to Toe, something like that. And we are planning a community event for September where we'll have community resources. We'll have maybe a very special speaker come and talk about adverse childhood experiences and that kind of thing. And I think that's, we're going to also have a mentor-mentee interview for the collaborative magazine.
Thank you. Okay. Committee C, Dr. Dillesey, do you want to share a little bit about what y'all talked about?
Yeah, we welcomed new members to sit in on our group, and we talked about what our original agenda was, and then we talked about the pending status of the grant to the Appalachian Regional Commission, a conference in September of 2022, if we're so lucky. But you know, the viability of this kind of work, looking underneath the hood of the deaths of despair, specifically with our group, the veterans, and it would be veterans focused and substance abuse, that we might be able to do with even like ARPA funds if we don't get funded. And, it's just like, how do you explain what we're trying to do with that grant? And so I showed a PowerPoint in production, and it has like 40 slides because there's a lot of things to this. And so we talked about how ambitious is this? Well, the grant was pretty ambitious, even though it was just a $50,000 idea for a conference. The idea being that if the conference leads to an implementation grant, then it becomes almost $500,000. And this is such an important topic right now, mental health, that it bears some discussion. And anybody can see what we get once it gets a little more polished, because you can tell that it's still got some pimples and blemishes that aren't ready for prime time. There's going to be more and more ideas in there that are ready to go live. If anybody in the group wants to speak up, that's great. I've got volunteers too.
Okay, well, we will put Dr. DeLucia's info out to you all too. So if you have any thoughts on his project or the project that Committee C is working on, you can let him know. Anything else before we wrap up?
Hard copies of the Carter County Collaborative magazine. I totally meant to bring them in today and left the whole pile on my desk. But I still have some hard copies of the June one. And then hopefully when we print out the next one in September, we'll have easier distribution. I'll bring all them in to the first meeting. After that, we can distribute them a little better. So if you want a hard copy of the magazine, keep that in mind.
All right. Thanks everybody for being here. We survived our first hybrid meeting. Yay! All right. Bye.